Many of the patients that we see in our clinic who suffer from hip pain because of hip arthritis or hip pain struggle to do any exercises which requires them to be on the floor. They can't get down and they can't get up. So what I've done is I've created a video with these exercises you can do on a chair. No need to go down, no need to get up, just from the comfort of a chair and just as effective. Okay, let's get started. So many of my patients who struggle with hip arthritis or hip pain also have difficulty actually getting onto the floor to perform those exercises. So I've developed a routine that you can do actually from a chair. No need to go down on the floor and struggling to getting up again. Everything just from the comfort of a chair. I think it's much more convenient for you to do this. So when you've got the hip problem or hip arthritis, there's essentially two structures we need to focus on. One is the hip itself. So I'm going to show you some exercises which will help with the mobility of the hip, but also we need to stretch the muscles which are directly related to the hip because they tend to get really tight as well. So the first two things we're going to do is focus on mobility of the hip joint itself. Exercise number one, super simple. So sit upright. Now I'm going to demonstrate this on the right hip. I'm going to place my right foot on my left knee, and all I do now is push my leg down, and we're aiming for a leg to be perpendicular to the floor, so 90 degrees, that's what we're aiming for. I'm using my elbow to push my knee down, and you're going to feel this on the outside of your hip. You could feel it in your groin as well, but mainly on the outside of your hip. So you push this down. Yeah. Now the important thing is when you push it down, is push down as far as you can. Some people might actually not be able to go beyond this kind of angle. That's absolutely fine. Just you start here and see how far you can get it down. You push it down. Now the aim is, this is important, hold this stretch for 30 seconds. So a bit longer than what we normally would do for muscles. That was normally about 10 seconds. Hold this for 30 seconds because you're trying to stretch out the capsule surrounding the joint, and that needs a bit more of a prolonged stretch. So you do this for 30 seconds and you repeat this about 3 times. Yeah? And then you do it essentially once a day. I would recommend to do the other hip as well. Say my right hip is really stiff and I've got more arthritis in there. I would definitely put more pressure on my left hip, just doing day to day, just to avoid pain on my right hip. So do your left hip as well. Again, same thing. You push it down and then hold this again for about 30 seconds. So that's the first exercise we need to do for the hip joint. Second exercise we're going to do for the hip joint, a simple one as well. We're sitting upright again on the edge of our chair. I'm now placing my right heel on the outside of my left knee. I'm demonstrating this for the left side, it's just easier for camera purposes. So my right heel is the outside of my left knee, and all I do now is I pull my left knee in as far as I can. So I sit upright, pull my left knee as far as I can. And what you can do to accentuate this a little bit more is you can now rotate your body towards the left. Yeah, and so pull this in, push it down a bit, push your leg a bit down a bit more. Yeah, and then you hold this again for about 30 seconds. So demonstrate this on the other side. So I'm placing my left heel on the outside of my right knee, sit upright, and I'm pulling my knee in. So I'm actually rotating over the inside of my foot, pulling my knee in, hold this again as far as I can. I'm rotating my body towards my right hip, the involved hip in this case. Hold it here to the side. Again, do 30 seconds and repeat this about 3 times every day. Something simple you can do on the chair. So those are 2 really good ones to do for the hip joint itself. Now you also need to stretch the muscles which are associated with the hip joint. So the first muscles we're going to stretch are called the adductors muscle, the adductors muscle, and they're located on the inside of your thighs. Again, simple thing, sit on the edge of your chair again. Now spread out your legs, yeah, as far as you can. Okay, have some straight knees and make sure your toes are pointing upwards. Yeah. Now support yourself on your upper legs. And all you do now is you bend forward as far as you can. Keep it straight back, roll forward, bend forward as far as you can. If you're struggling a little bit with balance, have like a little bit of a chair here or a stool, whatever you have, so you can put some hands on there. Come as far forward as you can. You should feel this now inside of your thighs. Now hold this stretch for about 10 seconds and repeat about 5 times. So 10 seconds 5 times, or forward here, 10 seconds. And you come back up again. You should really feel this on the inside here of your thigh. So you forward, have a little stool there for security, or you just come forward and hold your balance and do this 5 times. So that's what you should feel on the inside of your thighs. Yeah, knee straight, toes pointing forward. You could play with this a little bit, as in maybe you can drop your feet a little bit more outwards and then come forwards again, or drop your feet a little bit inwards, come forwards again. But the principle is the same. Play around with this a little bit, hold for 10 seconds, repeat 5 times. So those are the muscles on the inside of your thighs. Definitely you need to do these because they're going to be tight. Another muscle group is going to be tight when you're struggling with hip arthritis or hip pain are your hamstrings. Same thing, simple. Now we're putting our feet together. Again, toes pointing upwards, knees straight again, and all we do now is we lean forward. And you should feel this in the back of your knee, sometimes maybe even your calf, back of your knee, and at the back of your upper leg where your hamstrings, the muscles called hamstrings are located. So you go forwards as far as you can. You can do with the feet together. Again, same thing. You can turn your feet a little bit inwards and come forwards again. You could even feel on the outside of your hip, this one, stretching maybe the TFL, tensor fascia lata, but you're stretching this one, knees in, coming forwards. Hold this again for 10 seconds, repeat about 5 times, or just point your feet upwards and again just come forwards, and same thing, hold this for about 10 seconds and repeat 5 times. So good exercise there to do. So that's now the hamstrings and the adductors. Another muscle group we need to stretch out is a muscle group called the piriformis. And the piriformis muscle sits in your buttocks essentially. So what we do for this one is we come back to the position we did for our second stretch, is we are putting our right heel at the outside of our left knee. But now what we do is, instead of pushing the knee in, we're keeping the knee as it is. Yeah? We're pulling, in this case, my right knee towards my body. Yeah? So pull the right knee towards your body and turn your upper body towards the affected side. So in my case, the right side. Yeah? So I'm pulling this in my body, I'm rotating towards the right, and I really feel that here at the back area of the hip, in my glute area. So upright here, and then hold this stretch, really pull this leg in as far as you can, hold this for about, again, 10 seconds, repeat about 5 times, and do three sets of these. So you hold this to the side, and you pull this till you feel it, and that's a muscle called the piriformis. So the heel on the outside of your knee, don't drop your leg down, outside of your knee, pull your knee towards your butt, towards your chest, and rotate your body towards the involved side. This case is the right side. So obviously for the left side, it would be my left heel on the outside of my right knee, and then pull my knee towards my chest, and then I rotate, turning towards the involved side, which in this case, my left hip. Yeah, and again, hold for 10 seconds and repeat 5 times and do 3 sets. So that's for a muscle group, the piriformis. Now another thing you can do, if your muscles at the back are really tight, is you can use what we call trigger point therapy. And all we need for that is a ball. So I've got a tennis ball here, you can use a golf ball, you could even use a bit of a potato perhaps, something small and round. Same position, so I'm placing again for the right hip, my right heel, the outside of my left knee. I'm now lifting my right buttocks up a bit. I'm going to sit on this ball, find a tender spot, and just rotate where I feel this. A really good technique to loosen up those tight muscle knots that you might have in your buttocks. So something you can do again from the comfort of your chair. No need to go lay on the floor and struggling to get up again. Something really simple. Yeah, so find yourself a little bit of a ball, like I said, a golf ball or a tennis ball, whatever you do, and you sit on it. And then you find your tender spots and you just massage it for about 5 to 10 seconds, and then you move on to the next spot. Very good exercise to get some hip mobility back, to remove some tensions in those muscles which are connected to the hip joint. So that's a trigger point therapy for piriformis, or the glute muscles located at the back of your hips. Another muscle we can do is a muscle called the Quadratus Lumborum. That's located more in the lower back. Again, a stiff hip will probably also lead to a stiff area in the lower back. So what we need to do now is, again, we go back to the first stretch you did for muscles. So we widen our legs out as far as we can. Yeah. And now what we do is I'm going to demonstrate this again on the right side. So my right hand, yeah, now goes all the way over where my ear is. Yeah, all the way over, stretch out, and I'm aiming for the outside of my left knee. Yeah, so you need to go a little bit forward, aim for the outside of your left knee. And now you're stretching out a muscle called the QL, the Quadratus Lumborum, which sits more at the flank. And again, often associated with hip arthritis and hip wear and tear. So you go to the outside of your left knee or your left foot, the outside of your left foot in this case, and you aim for that. You see my hand palm is facing away from me. And I'm holding this stretch again for 10 seconds. I repeat this about 5 times and do 3 sets. And for the left side, so again, I've got my legs nicely spread out. My hand comes all the way over and touching my ear, hand palm facing forward, and then trying to touch the outside, aiming for the outside of my right foot, and it stretches out the flank on my left side. I need to bend a little bit forwards and then aim for the outside of my right foot here, stretching out the flank muscles, again associated with some hip wear and tear. Now, there's one more exercise I'd like to show you, and that's an exercise you need to do for the front, a muscle called Iliopsoas, in your groin area, a little bit higher up in your groin area, also very, very tight, and I'll demonstrate that next to you. So the final muscle that we need to stretch is a muscle called the Iliopsoas muscle, and that sits the front in your groin here. Very, very often that muscle is also associated with hip pain. It gets really, really tight with hip arthritis or hip pain. And again, no need for this exercise to go on the floor and struggling to get up. We're just going to use a chair and you're going to be nice and upright. So what we're going to do, simple as, I'm going to demonstrate this on the right side. On the left side, sorry, on the left side. So what I need to do, I'm going to place my right foot on top of the chair. If you're struggling with balance, just make sure you've got 2 chairs next to you, just again for a bit of balance. I'm placing my left foot behind me. Yeah, I'm ensuring at all times my left heel stays on the ground. I've got a straight left knee, and all I do now is I move my whole body forwards. See that? And I stretch now my left groin area. So I move my whole body forwards, stretching the left groin area. Hold this again for about 10 seconds. Repeat 5 times. Do 3 sets of these. Come forward, and you can really feel that in the inside of your groin. Again, you can play with this by maybe rotating your foot a little bit outwards. Perhaps you get the stretch. You feel the stretch a little bit more if you rotate your foot outwards, possibly a bit inwards, although unlikely, but hey, it can happen. So you are, again, left, make sure your left heel stays on the floor. Your left knee, in this case, stays straight. You can all put your whole body forward, so don't lean forward. Be upright. See, I'm placing my hands on my tummy and my lower back, and I'm moving the whole thing as one unit forward, and you can really feel that tension in the groin area there. Now, if this is not good enough, what you could also do in this position, so you move forward and then raise your hands up in the air. Yeah, and then really move your hands backwards, so you can see you're really creating like a whole stretch, a whole arch at the front here. So move your arms backwards. Again, hold this for, again, 10 seconds, repeat 5 times and do 3 sets. And that will help to stretch out your iliopsoas muscle. On the other side, same thing. So I'm now placing my left foot on top. Right heel stays on the floor, right knee stays straight. Moving my whole body forwards initially. See if I can feel this on my left side, my left groin. If I can't, what I can do is put my hands up in the air, really push my hands backwards, and make sure that I keep my left knee straight. My right knee straight, right heel on the floor, and again hold this for about 10 seconds. Do 5 repetitions and repeat 3 times on a daily basis. I hope you've enjoyed this video. I hope it was of value to you as well. If you enjoyed it, don't hesitate and just give me a thumbs up, please, for me. Leave a comment in the box down below if you have any questions, or if you want to let me know that you enjoyed the video. Subscribe to my channel as well, it helps with our reach. If you know anyone who struggles with a bit of hip pain, don't hesitate, and please feel free to forward this video to them. For now, I'd like to say take care of yourself, take care of someone else as well, please, if you can, and bye for now. Bye bye.